Welcome back to our 10-part series about metacognitive therapy. We're getting towards the end of the series and we're really starting to focus on how MCT can be applied. Today we're going to be looking at how MCT can be useful in treating specific conditions. Now we're still learning about the effectiveness of MCT because it is a relatively new treatment approach. So the research is ever growing, but there is a number of conditions where MCT is showing great promise as a treatment approach. Today we're going to be looking at MCT in the treatment of anxiety disorders, depression, OCD, and PTSD and trauma-related disorders. So MCT is grounded in the principle that it's not just about what we think, but how we think about what we think that shapes our mental health. We're not going to go into more detail of how MCT works in this video because that's what the previous videos in the series have already done. So if you've not seen them already and you do want to know more about MCT, then I recommend you go back and do that. I'll insert a link to the playlist right here where you can go back and see all the previous 8 videos of the series. Let's start off by looking at anxiety disorders, which is one of the mental challenges that MCT is showing the most promise in treating. So imagine living in a constant state of alarm, where worry about the future or social situations dominates your life. This is the reality for many people dealing with anxiety disorders. And MCT addresses these challenges head on by helping individuals fundamentally change their relationship with worry and fear. So through techniques like attention training technique, people learn to shift their focus away from perceived threats, fostering a sense of presence and calm. Detached mindfulness, which is another cornerstone of MCT, teaches the art of observing thoughts without judgment or immediate reaction. Research has consistently showed that MCT is highly effective in treating anxiety disorders. A recent study compared MCT with cognitive behavioral therapy in treating generalized anxiety disorder. It found that MCT led to significant reductions in worry, anxiety, and depressive symptoms. The study highlighted that approximately 70 to 80% of the participants receiving MCT achieved full recovery, a rate that's competitive with, if not superior to, traditional CBT approaches. Now let's look at another common mental disorder, depression. Depression can often feel like being stuck in a deep dark hole with no way out. MCT offers a ladder to those trapped in this despair by targeting the cycle of negative thoughts and the maladaptive beliefs fueling them. In the realm of depression, MCT has also shown promising results. A recent meta-analysis that reviewed several studies comparing MCT to other treatments for depression found that MCT not only significantly reduced symptoms of depression, also had lower dropout rates than other forms of therapy. This suggests that MCT is not only effective, but also more acceptable to clients. Specifically, the analysis reported recovery rates from depression in the MCT groups to be significantly higher compared to control groups, including those receiving CBT. Let's move on to Obsessive Compulsive Disorder, or OCD for short. OCD is characterized by intrusive, unwanted thoughts and repetitive behaviors that are intended to neutralize those thoughts. It's a disorder that can really take over your life, making even small tasks seem daunting. In essence, we can say that people suffering from OCD are really struggling with their metacognitive beliefs. These are the beliefs that can dictate our thoughts and our actions, just like we often see in OCD. A common metacognitive belief for those suffering from OCD is that they have to control their thoughts or their actions to avoid disaster. This is why MCT is particularly effective in treating OCD. It targets the metacognitive beliefs that fuels the repetitive behaviors and the intrusive thoughts. Studies show that MCT is very effective in treating OCD. Not only does it reduce the OCD symptoms, it also has a long-lasting effect. The final type of disorders we're going to be looking at today is PTSD and other trauma-related disorders. When suffering from PTSD and other trauma-related disorders, the past can have a constant and unwelcome presence in our lives. MCT offers a promising approach by focusing on the here and now, helping people to change their relationship with traumatic memories. MCT targets the maladaptive metacognitive beliefs that are related to the trauma. Studies show that MCT can significantly reduce some of the symptoms that we typically see in PTSD, including re-experiencing, avoidance, and hyperarousal. Some studies even suggest that over 60% of the people who underwent MCT treatment for PTSD no longer met the requirements for PTSD after treatment. This is showing great promise in MCT's effectiveness in dealing with trauma-related disorders. MCT's flexibility and effectiveness extends beyond these 4 types of disorders we've discussed in this video. But most of the studies that have been conducted so far looking into the effectiveness of MCT have focused on these 4 types of disorders. Now, in the context of more well-established therapeutic approaches, MCT is still relatively new. Because MCT is a newer approach, we don't have as much evidence for the effectiveness. But the fact that MCT is a relatively new approach also means it can be more difficult finding a therapist who is well trained in using it. That means that you may find that MCT isn't as widely available as some other treatment forms in your area. But it's incredibly exciting to see how this newer form of psychotherapy evolves and grows as we learn more about how it can be helpful. As we see a growing body of research, I'm sure we'll also see MCT becoming more widely available and it becoming more commonly used. Next week, we finish the series off with the last video. So in that final video, we're going to tie everything we've learned in the previous 9 videos together and look at how we can incorporate MCT into our daily lives. I upload new psychological insights, tips and tools on this channel, all aimed at spreading mental health awareness and helping you improve your mental well-being. If you're not already, I'd love for you to subscribe so we can meet again. Thank you for watching this one, take care, and bye for now.